Welcome back to Drugs and Behavior with Dr. Goodin. Today we'll be talking about Chapter 3, How Drugs Work in the Body and on the Mind. Here I've put a picture of a very common advertisement in the 80s and 90s that involved the phrase, "This is your brain on drugs." I try to show you what your brain on drugs looked like. Some of you may be familiar with this. Not all drugs are bad. The effects of drugs are positive or negative depending on how they interact with physiological processes in the body. Scientists don't always understand the interaction of a drug with the physiology of the brain. 4 ways of taking drugs. Oral administration, injection, inhalation, and absorption through the skin or membranes. In this chapter we are talking about both legal and illegal drugs used for good and bad purposes. Oral administration means taking the drug by mouth, digesting and absorbing it into the bloodstream through the gastrointestinal tract. Some drugs can be more quickly absorbed into the bloodstream by being taken sublingually, which means under the tongue. It normally takes 5 to 30 minutes for the absorption process to be completed, and this is helpful if there is a potential overdose or accidental dosing because you can pump the stomach or induce vomiting. Note that we usually take a drug in the most effective way. Since morphine is broken down by the stomach acids, we may wish to have injected it. Food in the GI tract may also play a role in slowing absorption. Intravenous injection delivers the drug into a vein without any intermediary tissue. It is often called mainlining. If you put the wrong thing in your arm, though, there is no turning back. Repeated injections may cause veins to collapse or develop blood clots. With intramuscular injections, the drug is delivered into the large muscle, usually in the upper arm, thigh, or buttock, and is absorbed into the bloodstream through the capillaries serving the muscle. They can be administered more rapidly in emergency situations. Most flu shots are injected this way, as are many vaccinations. Subcutaneous delivery involves a needle inserted into the skin tissue just underneath the skin and results in slower absorption time. This may irritate the skin and is referred to as skin popping. All injections require a needle to pierce the skin, so there is an inherent risk of bacterial or viral infection if the needle is not sterile. Inhalation involves inhaling a drug in some form of gaseous or vaporous state. The alveoli within the lungs can be imagined as a huge surface area with blood vessels lying immediately behind it. Ways to inhale include burning the substance and breathing in the smoke-borne particles in the air. It may cause long-term hazards of breathing particles in the air that contain the drug, the tars, and other substances produced by the burning process. It may lead to emphysema, asthma, and lung cancer. It may also damage the linings leading from the throat to the lungs. Absorption through the skin and membranes. One can sniff or snort a drug in dust or powder form into the nose, called intranasal administration. Sublingual administration falls into this category since it is not swallowed. A transdermal patch allows the drug to slowly diffuse through the skin. Now we'll talk about how drugs exit through the body. The most common means of elimination is through excretion in the urine after a series of actions in the liver and kidneys. Elimination also occurs through excretion in exhaled breath, feces, sweat, saliva, or breast milk. Biotransformation is the process of changing the molecular structure of the drug into forms that make it easier for the body to excrete it. The products of biotransformation are referred to as metabolites. The type of drug results in how long this process takes. The index of how rapidly or slowly a particular drug is eliminated is referred to as its elimination half-life, defined as the amount of time it takes for the drug in the bloodstream to decline to 50% of its original concentration level. While cocaine and nicotine have very short half-lives, marijuana and some prescription medicines have very long half-lives. Factors determining the behavioral impact of drugs. When two drugs are administered close together in time, we must also consider how these drugs are interacting with each other in terms of their acute and chronic effects. Also, the same dosage of the same drug may affect two individuals differently, based on body weight, gender, and ethnicity. With regard to timing, after a drug is taken, there is an initial interval called the latency period, during which the concentration of the drug is increasing in the bloodstream but is not yet high enough for the behavioral effect of the drug to be detected. The length of latency period is related to the absorption time of the drug. When it reaches maximum levels in the bloodstream, it has its desired effects, but may cause side effects. Some drugs are released in the body slowly via time release form. This cuts down on the amount of the drug in the blood at one time, which may lead to toxic side effects. Drug interactions. Most lay people do not know how drugs interact, which is why medical doctors, especially psychiatrists, are important consultants. There are two basic types of interactions. Two drugs combine to produce an acute effect that is greater than the effect of either drug administered separately, which is called an additive effect. The acute combination effect is hyperadditive, with the combined effect exceeding the sum of the individual drugs administered alone. This is called synergism. One drug may double or triple the effect of another, and one drug may have no effect unless it is taken with another drug, and this is called potentiation. The danger of such interactions is that the combined effect of one drug is diminished to some degree when administered with another. The danger of such interactions is that the combined effect of the drugs may be so powerful that it is toxic and/or lethal. By the way, I'm reading my notes here. Sometimes I get out of place. I'm not going to go back and fix everything. So I'll just be human with you. I'll make mistakes, and I'll try to admit it, but just bear with me. Two drugs can be antagonistic. If the acute effect of one drug is diminished to some degree when administered with another. Consider taking Adderall and Klonopin. One is a stimulant and the other is a tranquilizer. They're going to work against each other. Now, before we move on to the nervous system, I do have a few more things to cover. Cross-tolerance and cross-dependence. When you take one class of drugs via one specific drug, but your tolerance for that specific drug generalizes, to the whole class of drugs. It is called cross-tolerance. Similarly, a person experiencing withdrawal from a drug may be able to find solace or may be able to get what they need by taking another drug of the same class in a process called cross-dependence. An alcoholic who cannot afford liquor may drink rubbing alcohol. There are also individual differences. Generally, a heavier person will require a greater amount of a drug than a lighter person to obtain an equivalent drug effect. Regardless of height or weight, women are usually more sensitive to drugs due to lower water content and reduced levels of enzymes and increased levels of estrogen and progesterone. Ethnicity also matters. Those of Asian descent often lack an enzyme that breaks down alcohol quickly, producing a faster heart rate, facial flushing, and nausea. Many Asians find drinking quite unpleasant. Caucasians also biotransform antipsychotic and anti-anxiety medications faster than Asians. Whites metabolize nicotine faster than African Americans, so African Americans smoke fewer cigarettes per day on average. Now, introducing the nervous system. The central nervous system consists of the brain and the spinal cord. The peripheral nervous system is the portion of the nervous system that consists of nerves and nerve fibers that carry information to the central nervous system and outward to muscles and glands. The peripheral nervous system generates two basic types of responses. Somatic responses are voluntary reactions executed by skeletal muscles that are attached to bone. Autonomic responses are involuntary and executed by smooth muscles that form the walls of arteries, veins, capillaries, and internal organs, as well as cardiac muscles that form the walls of the heart. An example is when you blush or when you breathe. Sympathetic and parasympathetic branches of the autonomic nervous system are very important. The sympathetic branch of the autonomic nervous system is the portion that controls bodily changes that deal with stressful or emergency situations. It often deals with fight or flight situations. In contrast, the parasympathetic branch controls the bodily changes that lead to increased nurturance, rest, and maintenance. It actually calms us down after that emergency situation. Neuroanatomists have classified brain tissue into three major sections, which you can see some of here. You can see all of them. The hindbrain, the midbrain, and the forebrain. Of course, we can get much more specific, but here's a quick look. I will not be testing you on the details of brain structures or processes, except to the extent that they must be named and understood as part of the dynamic interplay between drugs, the body, and behavior. But I will point those situations out, okay? This class is not about memorizing the parts of the brain, okay? And I don't think the midbrain is even included in here. I mean, it's included, it's just not pointed out. While I'm dealing with that, let's go back for a second. You may notice that the pictures are meant to fit with what I'm talking about, but they can't cover everything I'm talking about. They're meant to elicit maybe the making of a memory. So I will often use a picture that sort of provides an example of what I'm talking about, and will help you sort of associate maybe a movie character with what's going on, or even just the visualization. The more associations you make between the information you need to learn, the better chance you'll have of remembering it, the more triggers you'll have to remember the information. Okay. So for instance, here we have neuron 1, not that it's called that, but a neuron, another neuron. We'll call this neuron 1, neuron 2. This part is called the synapse. And here we have neurotransmitters crossing across from neuron 1 to neuron 2 from what are called synaptic vesicles, or sacs. Vesicle means sacs. Okay. The neurotransmitters are released across, and they reach receptors where they can bind, or if they do not bind, they are sent back in a process called reuptake, and they settle back into the synaptic vesicles. Okay, this process happens from the beginning, which you don't see the beginning. This is sort of the beginning of a neuron, ends up at the end of the neuron, transfers to the next neuron, and so forth, throughout your brain all the time. Now, between here and the end is the cell membrane, the axon, and then reaching the axon terminal. We'll talk about that shortly. Rather than focus on where certain psychoactive drugs are active, it may be more important for this class to understand how they work. Therefore, you need to know about neurons, which is what we were just talking about, right? A neuron at any time is either on or off like a light switch. And this has to do with a process called, does anybody know? Find out the name of the process. Activating potential should be a key word you look at. The on state is accomplished by the generation of a nerve impulse. The unique role of the neuron is to receive information and to transform information. Now, in order to just give us some context here, I want you to understand that information in the form of chemicals and electrical responses gets to these neurons in a specific way, through your eyesight, through your nose, through your hearing, through your touch. What's the other one? Smelling, seeing, sight, touch, taste. Okay. All right. And so your senses produce information that your brain starts to transmit to important physiological sections of your brain. So it's transmitted appropriately this way. This is not just thinking. This is your brain, sometimes even subconsciously, just doing what it needs to do. You see something, guess what happens? You need to move your arm. Your brain tells one neuron or several neurons to move your arm. And this process starts to occur, transmitting neurotransmitters, exciting the next neuron, transmitting more neurotransmitters, until the message via chemicals and electrical impulse reaches the part of your brain that tells the muscles to raise your arm. Okay? The unique role of the neuron is to receive information and to transmit information, a task that it carries out through its three principal components: the cell body, the dendrites, and the axon. If you want to see a picture of that, I may have one, but if not, feel free to Google it. Use any search engine you wish, of course. The appendages of the neuron make it specialized for communication. Okay? They emerge from the cell body. The short ones are called dendrites to represent the part of the neuron that receives information from the outside, usually depicted on the left in pictures. And then there's a long appendage called the axon. Let's see if I have a picture of this. Nope. The long appendage called the axon is the part that transmits information outward at about 270 miles per hour until it reaches the axon's endpoint. At this terminal point of each of these branches are small bud-like structures called synaptic knobs. Nerve impulses from one neuron can influence the emission of nerve impulses on other neurons by sending neurotransmitters across the synapses or the spaces between neurons. Neurotransmitters are located inside the synaptic knob within synaptic vesicles. When the nerve impulse reaches the synaptic knob, it causes neurotransmitters to be released out of these vesicles. The neurotransmitters then migrate across the intervening gap between neurons and quickly arrive at the other side. That gap is called the synaptic gap. They reach the other side where there are receptors specifically designed to match the shape of the neurotransmitters. This process is called binding, produces one or two possible changes in the receiving neuron, excitation, or inhibition. Now, excitation means that there is an increase in the number of nerve impulses per second that are emitted by the receiving neuron, whereas inhibition means that there is a decrease. Some neurotransmitters are excitatory, based on the receptors that they match to, while others are inhibitory. After they have produced their excitatory or inhibitory effect, neurotransmitters return back to the vesicles in the synapse knob or synaptic knob. So for a second, I'm going to just pull up an example for you. Okay, so let's take a look here. What do we want to see? And we want to see a neuron. And this looks like a simple example. These are the dendrites. Okay, notice there are plenty. And they're like fingers. The nucleus is located within the cell body. Okay. This part is called the axon hillock. And then this long structure, it's about 10,000 times as long as this is wide. Okay? The axons are really, really long. And it's coated with myelin sheaths, which helps speed up the process of transferring the excitatory electronic pulse. Okay, notice chemicals arrive at receptors here, and they're transferred to the axon hillock. And once action potential is reached, an electric pulse is sent to the axon ending or axon terminal. Okay, and at that point, let's see if we have a better picture here. To these terminal buttons where Actually, this is a better picture. These terminal buttons, this is one terminal button with synaptic vesicles on it. And the word is action potential. I believe I misspoke earlier. And once action potential is reached, an electric pulse is sent across the axon, reaching these terminal buds and these synaptic vesicles or sacs. They open up, release neurotransmitters. Okay. So, what we're going to be seeing is that when neurotransmitters seek to bind at the receptors, there's sometimes problems. Sometimes we're just imbalanced. We have chemical imbalances. We have natural problems, like people get broken legs, or people have eyesight problems. Sometimes people have chemical imbalances, and neurotransmitters are not sent and received appropriately. And so we may not be getting enough, for instance, dopamine, serotonin, norepinephrine on this side being sent throughout the brain, and we might have a mood, we might be depressed. Also, one thing I want you to note is that psychiatric medicines can help with this. They sometimes, when there's an imbalance and reuptake is taking place, the medication comes in and pushes all these neurotransmitters. It pushes them into the next neuron, even though they're trying to be sent back. It sort of tries to flood the next neuron in order to regain balance of the chemicals. Now, what also happens is any drug you take, any psychoactive drug, cocaine, ecstasy, these drugs also act like neurotransmitters. They either mess with the neurotransmitters and sort of flood the system or inhibit the system, or they pretend to be a neurotransmitter, bind with the receptor, and do what a neurotransmitter does. Now, the high you often feel, depending on the drug, is a result of this flooding process, which is unregulated in terms of illegal drugs. Okay? Remember, excitation means there is an increase in the number of nerve impulses per second that are emitted by the receiving neuron, and inhibition means there is a decrease. Drugs can influence the functioning of neurons by increasing the quantity of neurotransmitters released into the synapse from the synaptic knob. Some drugs resemble a neurotransmitter. You'll notice I've just talked about this. Say it again in different words. Thus, a greater degree of excitation or inhibition can occur because the drug and the neurotransmitter are arriving at the receptor site at the same time, and the receptors are unable to tell the difference. Drugs may diminish the likelihood of receptor binding by blocking the neurotransmitter at the receptor site. Neurons send nerve impulses in very rapid succession, so neurotransmitters cannot remain in the receptor for more than a millisecond or two. In most cases, once the neurotransmitter binds to the receptor, it is simply expelled and transported in its intact form back to the synaptic knob. This process is referred to as reuptake. You need to know that word, reuptake, and understand this process. If I haven't explained it to your liking, I suggest it's really easy. Google search. You can search for neurotransmitter reuptake. The speed of reuptake can be modified by a specific drug affecting neuronal communication. If reuptake is slowed down, the neurotransmitter remains in the receptor longer and receptor binding is enhanced, and vice versa. Cocaine and some antidepressant drugs accomplish their stimulant effects by slowing down or even blocking the reuptake process, pushing extra neurotransmitters into the next cell or neuron. In some cases, receptor binding is followed by the neurotransmitter being broken apart by specific enzymes in the synapse and reconstructed back in the synaptic knob for future use. Drugs that inhibit these enzymes cause the breakdown process to be diminished. The neurotransmitter remains longer in the receptor, and receptor binding is enhanced. Now, the big 7 neurotransmitters. Take a breath. Add some tea. We're going to talk about that in later chapters. Acetylcholine, norepinephrine, dopamine, which involves emotionality and motor control, serotonin, emotionality and sleep patterns, GABA, an inhibitory neurotransmitter that has to do with anti-anxiety, glutamate, an excitatory neurotransmitter, and finally, endorphins, which are painkillers. Let me name those again. Acetylcholine, norepinephrine, dopamine, serotonin, GABA, glutamate, endorphins. The blood-brain barrier is a system whereby some substances in the bloodstream are excluded from entering the nervous system. Metabolic or dispositional tolerance involves a drug facilitating, over repeated administrations, the processes that produce the drug's biotransformation in the liver. The habitual drinker feels less of an alcoholic effect and compensates by increasing the amount that they consume. Cellular or pharmacodynamic tolerance involves changes that occur in the synapses of neurons themselves. Receptors that have been stimulated by the drug over time may become less sensitive to neurotransmitters that ordinarily affect them. The excitatory or inhibitory effect on the receiving neuron may be diminished. Repeated blocking of the receptors by a drug over time may cause a compensatory reaction, such as an increase in the number of receptors or an increase in the amount of neurotransmitters released. With most drugs, there is a tremendous feeling of satisfaction as they enter the bloodstream in the brain, and an intense craving for repeating that experience. Two of the key elements in the rewarding effect of these psychoactive drugs are dopamine in a grouping of neurons lying in a region of the limbic system called the nucleus accumbens. Dopamine-related processes in the nucleus accumbens underlie the reinforcing effects of many abuse drugs, compulsive gambling, and compulsive eating disorders. Some individual differences observed in dopamine receptor concentrations are at least in part genetically based. In the case of nicotine, the inclination to begin smoking is highly genetic at 75%. Genetics account for 60% of the tendency to become dependent on nicotine and 54% of the ability to quit. Genetic predispositions make it important for people to know their family history of substance use and abuse and to be cautious about areas in which they are vulnerable. It may be best to think of the effects of a drug being the result of a three-way interaction of the drug's pharmacological properties, the individual taking the drug, and the immediate environment within which drug-taking behavior is occurring. Obviously, the higher the drug dosage, the more that pharmacological effects play a role in this dynamic. As with the placebo effect, expectations play a large role in what a drug does to the body. If you believe that a drug will make you drunk, the chances are increased that it will do so. On occasion, doctors may prescribe a placebo to a patient without them knowing. A great amount of research has been done with placebo drugs. Some drug research wherein the participant does not know the plan is called single-blind, while other research is double-blind. In these cases, even the doctor does not know which patient is receiving the placebo or the treatment being the actual medication. I will see you in Chapter 4.